Hey guys, Carlos the Insurance Guy here with Expert Insurance Team. Today we wanted to give you a high-level 30,000-foot view of what Medicare is. You can spend 2 or 3 hours learning exactly what Medicare is all about. We'll try to do it for you in a shorter period of time. If there's any questions that anyone may have, please do not hesitate to reach out to us. We do this for a living. We tend to think we're the best at what we do. But sometimes things change, right? Things change like we change our underwear. So we try to stay up to date. We try to keep in front of everything. So if there's any questions that you may have, anything that you need help understanding, please don't hesitate to reach out to us. And if you're not reaching out to us, reach out to somebody because, again, everything that we do, any service that we provide to you or any service that the next agent or broker down the road provides to you, it's going to be free of charge. Okay, so in this description, I'm going to put our contact information, and we will definitely put other links to anything that's pertinent to what we're going to talk about today. Okay, so this is us. This is me and my wife, but we are associated with a larger group of health insurance brokers. The agency is called Healthcare Solutions Team. We have agents all across the country, about 1,500 of us now. So it's not just us backing you. We have the support of 1,500 other agents that are willing to help us out. Okay, so again, don't be afraid to reach out to us. So what is Medicare? Medicare is usually for 3 groups of people. The first group is people who are turning 65 or older, people who are 65 or older. The second group is for people that are under 65 with certain disabilities. Okay, and the last group of folks are anybody at any age that has End-Stage Renal Disease or ALS, also commonly known as Lou Gehrig's disease. Okay, CMS is the government branch that is running all of Medicare. They are the Center for Medicare and Medicaid Services. They are the ones that set all the rules and standardize everything. Okay, how can you enroll into Medicare? There's a few ways you can enroll. You can go straight to your Social Security office. You can get on the phone with them, or we can help you do the application online at ssa.gov. Okay. Sometimes they give you Social Security, they give you Medicare automatically if you are collecting Social Security disability. If you've been collecting Social Security disability for about for 2 years, then they're automatically going to send you your red, white, and blue card, and we'll get into that in a second. Okay. You can also enroll through the Railroad Retirement Board if that pertains to you. Okay. So now, Let's talk about private insurance. Okay, Medicare does not cover all Medicare medical costs and drug costs. Okay, contrary to what people may think, Medicare wasn't invented or made for. Isn't a policy that's supposed to cover everything. If you honestly talk to actuaries, they probably say it covers about 50% of everything, but really it should cover about 20% of all doctor and hospital bills. Okay, and we'll talk about what we need to do to cover that other 20%. Okay, so it does not cover any medical. It does not cover all of your medical or drug costs. So most people buy from private insurance companies to help pay for medical expenses like that are not covered by Medicare. And these plans are Medicare Supplements, also known as Medigap Policies, Medicare Advantage plans, cost plans, and Medicare prescription drug plans. Okay, so we'll talk about those here in a second. So there are 5 parts to Medicare. I say there are five parts to Medicare. Parts A, B, C, and D, and then there is something called Medicare Supplements. And to make it even more confusing, the Medicare Supplements are categorized by letters as well, and we'll go into that here in a second. So let's just get some terminology down. That red, white, and blue card is what we're going to call Original Medicare. That is your Part A and your Part B. Okay? So what are these different parts to Medicare? So Part A is your hospital insurance. Anything that has to do with the hospital building is usually the easiest way to explain it. Part B is your medical insurance. Let's say it's your doctor insurance, your providers. Anything that has to do with services given to you by people and the buildings outside a hospital, let's say. Okay. Part C is an all-encompassing Part A, B, and D. D is your Medicare drug plan, your prescription drugs. D is for drugs. Okay. So 4 parts: A, B, C, and D. A is hospital. B is doctors. C, let's go to D. D is prescription drugs. And then C is all-in-one. Okay, we'll get into details about how Part C works. Talking about Part A first. So Part A is hospital insurance again, provides coverage for hospital, nursing home, home health care, and hospice. Okay? Usually, Part A is premium free. It's $0. And it's $0 because most people who are eligible for Medicare have worked here all their life, minimum 10 years of their life, and they've paid into Medicare for those 10 years. They paid their Medicare tax for 40 quarters. Okay, that's what we're going to call premium-free Part A. Okay. Now, if you haven't worked here for over 10 years and you haven't paid into Medicare tax for 40 quarters, then you can buy Part A. You can buy Part A for $413 a month. If you paid Medicare taxes for less than 30 quarters, then if you've paid into Medicare tax for 30 to 39 quarters, then your premium will be $227 for 2018. Okay. Part B. Part B is your medical or doctor insurance, right? It covers your doctor's visits, your outpatient procedures, your diagnostic tests, medical supplies, vaccines, and screenings. Your mammograms, diabetes, prostate, and other types of screenings as well. Okay. Part B has a standard premium. That standard premium is $134 a year. Excuse me, $134 a month. And usually that comes directly out of your Social Security check. Okay? If you're collecting Social Security, then they're going to take it straight out of that amount before they even deposit the money into your bank account. Okay? Most people have to sign up for Part B. Part B is optional, but the way Medicare lays it all out, it's not a good idea just to have Part A because, again, we've learned that Medicare Part A is for hospitals. Who's going to help us take care of some of our doctor bills, and that's where Part B is going to come in. On top of that, if you delay Part B, then there is a penalty, and we won't talk about it here today in this video, but I'll put a link in the description for another video that goes over your Part B penalties. Okay, if you delay Part B or if you miss signing up for Part B. That also, again, that's usually deducted from your Social Security check. Okay, the 134. It's 134 in 2018. All right, let's skip over Part C purposely and go straight to Medicare Part D. Medicare Part D is your drug plan, right? Prescription drug plan. They are offered by private insurance companies. This does not come directly from the government. Okay, so we have to look into private insurance companies that are offering Medicare drug plans Part Ds. Okay, the cost can vary. Every Medicare drug plan has a different premium. Okay, people who are making some pretty good money every year, I think it's around $80,000. Again, we're going to put a link in the description about what's called IRMA. If you're making more than the average, then the government is allowed to charge you more for your Part D, which is unfortunate, but fortunately you're making some pretty good money. Okay, every plan has a unique list of drugs in different tiers, which is called the formulary. Okay, definitely when you reach out to us, we're going to be talking about your medications and what tier level they fall in the formulary. Okay, and we're definitely going to be talking about how it's not a bad idea to go over your Medicare drug plan every year because formularies change all the time. Okay, You can purchase a Medicare Part D standalone, or it can be, like I said, all encompassing into that Medicare Advantage Part C. Okay, let's see how it works. Can sign up when you're first eligible. Obviously, it's optional. If you delay your enrollment into your Part D, there may be a late enrollment penalty. It's 1% from the national average every month for the rest of your life. So again, Part D is optional, but the way it's written, they kind of don't make it optional for you, because if you delay your Part D, then they're going to charge you a 1% penalty every month you went without it for the rest of your life. So definitely reach out to us. Have your list of medications ready, the dosage, how often you take it, and whether you get a 1 month or a 3 month supply, and if there's a pharmacy you just can't live without, get all that information ready, and we'll definitely figure out your Part D. Okay, so let's keep it moving. This is just how Part D plans work. I'm going to put a link in the description about how Part D has different stages of coverage. Okay, so you learn a little bit more about that. Again, we can talk about Medicare all day, and it'll take us, the full 8 hours to figure this all out. But we've already have videos on the different parts. Okay, let's jump into Medicare Part C, which are Medicare Advantage plans. This acts as primary insurance in place of original Medicare. Okay, so you have decided to no longer have original Medicare from the government. You've decided to let your services, your care be directed by a private insurance company, like the Blues, like the Humanas, like the Aetnas, like the WellCares of the world. Okay, I think it was like 1985 where the government got sick of paying everybody's Medicare claims, and they said, how can we pawn this over to the private insurance companies? And this is where Medicare Advantage was invented. They said, let's pay the private insurance companies maybe a subsidy every month and let them professionally direct their care. Okay, and this is again where Medicare Advantage came into play. Most still, if you're on a Medicare Advantage plan, you still have to pay your Part B premium. Okay, that's just something we can't get around unless we're eligible for some extra help to pay for that, depending on your income. And again, we'll put a link in the description about getting extra help to pay for your Part B and your Medicare drug plans. But if you're going to get a Medicare Advantage plan, you still have to pay your $134 for your Part B. Medicare Advantage plans are usually a very low premium. There are a lot of $0 premium Medicare Advantage plans out there, and they just go up from there. But the average, I would say, in my personal opinion, my personal experience, is a $0 premium. Let's say a Medicare Advantage plan is a pay-as-you-go plan. Okay, you're no longer covered under original Medicare Part A. We talked about that. We decided to have our care directed by a private insurance company. Okay, but you still get all the benefits. You still get everything that was covered in original Medicare is going to be covered in your Medicare Advantage plan. Okay, so they don't say that a routine preventative care is covered with original Medicare and not with Medicare Advantage. That's not the way it goes. Okay, premiums are not gender or age based, rather determined by the area where you're purchased. You're going to find Medicare Advantage plans in areas where there's a good population. Unfortunately, in areas where there is a small population, it is going to be very unlikely that there's going to be a Medicare Advantage plan out there. So it's just a matter of giving us a buzz and figuring out what options are available in your area. Okay, there is no medical underwriting except for ESRD. If you have End-Stage Renal Disease, then that's a whole nother monster. We'll talk about that as well, and I'm sure I'll put a link in the description below talking about ESRD. But if you're eligible for a Medicare Advantage plan, all we have to do is sign up and get it. They're not going to ask us any medical questions. Okay. Usually a Medicare Advantage plan does include your prescription drug coverage. Okay, but there are some Medicare Advantage plans out there that don't. Okay, but 999 times out of 1,000, we're doing policies. We're doing Medicare Advantage plans with prescription drug already embedded. Medicare Advantage plan can have extra benefits, such as routine vision, hearing, dental, and gym memberships. I highly suggest that you get a more comprehensive plan on the vision and hearing and dental, because it's usually very, very basic, like routine cleanings, but it depends on the plan that we're looking at. But 99 out of 100 times we're always having to add on an extra dental, vision, and hearing policy. Okay, but let's go over the summary of benefits of the plan that we're looking at and figure it out. Okay, again, it's an all-in-one plan. You're just going to have one insurance card. You're going to carry that around with you. You're going to present that at the doctor's office, the labs, or the pharmacy. Okay, so that is a Medicare Advantage plan. How it works: must be enrolled in original Medicare Parts A and B. Obviously, you can't get a Medicare Advantage plan without having original Medicare in place. Okay, you must continue to pay your Medicare Part B premium along with Medicare Advantage premiums. Obviously, we talked about that. You pay a co-payment or co-insurance only for services you use. So again, it's like a pay-as-you-go plan. There's usually co-payments for everything, except chemotherapy is usually the one that doesn't have co-payments. That's usually the one where you're going to have to pay your 20% and then, until you meet your out-of-pocket. But again, let's go over the Medicare Advantage plan that is specific to you and go over the benefits. We'll tell you everything that is good, bad, and super ugly about the plan, and you can tell us if it's something that you feel comfortable with. Okay. The biggest thing with Medicare Advantage is that they usually have it's usually an HMO plan. There are PPO plans and other types of plans out there, but they're usually HMO plans where you have to stay within the network of the plan. Remember that you decided to not get your Medicare ran by the government, but private insurance companies. So a lot of the way private insurance companies save money is they develop this network of doctors and hospitals that agree to their the reimbursement rates, right? So you're always going to have to stay within the network of the policy, which most people are used to. Most people come from a group health insurance policy or a private insurance plan. Nowadays, they're usually HMO plans where they're used to having one doctor that professionally directs your care. But again, let's figure out what's in your area. Whether they're HMO or PPOs, we'll tell you exactly how it works. We'll figure out if your doctor or hospital is in the network, and we'll continue to go from there. Okay? So now, let's talk about the fifth part of Medicare, and that is Medicare Supplements, also known as Medigap Policies. Okay? Medigap Policies are secondary insurance to Medicare. They're not primary. Okay? If you purchase a Medicare Supplement or a Medigap policy, you're going to be walking around with two cards: your red, white, and blue original Medicare, and your Medigap, your Medicare Supplement policy. Okay? Usually Medigap policies cover the costs that are not covered by original Medicare, Parts A and B. Okay? Parts A and B, everybody knows that it usually covers about 80% of all doctor and hospital bills. Okay? Part A has deductibles. Part A has deductibles that you have to meet every 90 days, basically. And on top of that, you have to cover the 20%. Excuse me. And B has a deductible of $183 for 2018 as well. Plus, on top of that, you'd have to meet the other 20%. Okay? So the question is, who's going to help us pay for those deductibles and those other 20%? And that's where Medigap policies come in. Okay? So they help cover the cost of deductibles, co-payments, and co-insurance. The greatest thing about a Medicare supplement plan, if you decide to go that route, is that you can go to any doctor or hospital in this country that accepts Medicare. Okay, if you want to go to the cancer center down in Texas or the Mayo Clinic in Minnesota, no one's going to say you can't, right? It's a PPO plan, let's call it, without having to get a referral. Okay, about 97% of all doctor and hospitals accept original Medicare. If they accept your original Medicare, they have to accept your Medicare supplement. Okay, doesn't matter which Medicare supplement you have, they have to accept it. Okay, you can choose any doctor or provider that accepts Medicare. We talked about that. 10 standardized plans designed by the federal government. Again, we talked about how they try to make it as confusing as possible, and Medicare supplements are categorized with these letters A, B, C, D, F, G, K, L, M, and N. And also a high deductible plan F. Again, more confusing. But the three main Medigap policies that are the most popular at the moment are Plan F, Plan G, and Plan N. And I'll say from my experience that Plan G is the most popular out of the three. About 97% of all my clients are going with Plan G, and we'll talk about that. We'll talk about that in another video. Okay, again, we'll talk about the differences between F, G, and N. Okay, for now, we're just doing an overview. Plans may vary by cover and premium. Again, the Medigap plans. Let's just talk about this. They're standardized across all carriers. So if you had a Plan G with Blue Cross Blue Shield, or a Plan G with AARP, or a Plan G with Mutual of Omaha, the coverage is going to be the same. If you had a Plan G with Joe's Chicken and Waffles, it doesn't matter. CMS, the Center for Medicare and Medicaid Services, says that the coverage is going to be the same. Okay? The only thing that they really compete on is price and just themselves, right? AARP may be a different monster to deal with than Humana or Mutual of Omaha or Blue Cross Blue Shield. Okay, but they really only compete in price. The coverage is going to be the same. Okay. Again, the most comprehensive is Plan F. Plan F covers everything that original Medicare doesn't cover. Okay, but we'll talk about that in another video. Medigap policies do not cover these benefits: vision, hearing, dental, long-term care, or Medicare drugs or prescription drugs. So we're always having to offer a separate vision, hearing, dental plan, definitely a long-term care policy. Contrary to what people may think, Medicare doesn't cover long-term care. Okay, and again, we'll talk about long-term care in a different video. There's a link in the description below sometime soon. But when you no longer can get benefit from, let's say, physical therapy, and it's no longer an acute illness and it's chronic now, and you can no longer do 2 out of the 6 activities of daily living, like bathing, going to the bathroom, feeding yourself, 2 out of the 6, then that's where long-term care is supposed to come in and save us some headaches, save us a lot of headaches. Okay. Medigap policies do not cover Medicare drug plans. That's for sure. So we're always having to add on a Part D, a standalone Part D. Okay, so one way you're going to be on one street, you'd have the original Medicare, your Medigap policy, and a prescription drug card. Okay, the other road is going to be the Medicare Advantage, and we'll talk about that here in a second. Oh, actually, it's the next slide, right? All right, so there's 2 ways you can go about this. 2 roads you can take. Option number 1 is going with original Medicare, which is Part A and B, hospital and doctors, adding on a Medicare drug plan to cover our medications, and then also adding a Medigap policy to cover the gaps in original Medicare, to cover everything that Medicare doesn't cover. Okay, I like offering that option first. It is the more expensive route, but it's the most comprehensive and with less restrictions. Okay, and the best time to purchase a Medigap policy is 6 months after you turn 65 years old, because during that time period, it's what we call your open enrollment period, or it's guaranteed issued. If you want a Medigap policy, all you have to do is apply, and they'll give it to you. They're not going to ask us anything about your medical history. Remember, these are sold by private insurance companies. Okay, If we decide we want a Medigap policy after 6 months of turning 65 years old, then they have the right to ask us medical questions. If we're sick and unhealthy and we're seeing the doctor often, then they might say, listen, we don't want you part of our club. You're gonna cost us too much. Okay, so the best time to purchase a Medigap policy is when you're first eligible for Medicare, and 6 months after you turn, or 6 months after you turn 65 years old. Okay, so think about it. Option number 2 is going with a Medicare Advantage plan, which has its pros and cons as well. Okay, Medicare Advantage, we know that it's an all-encompassing Part A, Part B, and Part D, all in one, which makes it simple. Okay, but we have decided to no longer have Medicare ran by the government, but rather by a private insurance company, and we have to follow all their rules, which usually means that there's going to be co-payments for a lot of things, there's going to be deductibles, and there's going to be out-of-pocket maximums. Okay, and the biggest thing is having to use their network of doctors and hospitals. Okay, so if there's a doctor or hospital that you've been seeing all your life, tell me who he is, and we'll figure out if they accept the Medicare Advantage plan that we're looking at. Okay, that's the major downside, is being limited to the network of doctors and hospitals. The best part about Medicare Advantage is the fact that it's a very, very low premium. It's usually $0 premium. Okay, so that a lot of seniors are on fixed incomes, which having a $0 premium plan is very, very enticing and very much what we're looking for. So we have to talk about the differences. Okay, so again, that's just a high level. We can talk about Original Medicare and Part C when you're ready to talk about it. Okay, so that's just another way to look at choosing Medicare. Open enrollment. Open enrollment is every year from October 15th through December 7th. During this time period, if you're on a Medicare Advantage or a prescription drug plan Part D, you can do 3 things during this time period. You can either change your Medicare Advantage or prescription drug plan, you can drop it, or if you want it and you've never enrolled before, then you can get one. So you can enroll in a Medicare Advantage or a Part D. You can change to a different company, or you can drop it. You can go back to your original Medicare if you wanted to. Okay, any change that you make during that time period, during open enrollment, the policy is going to be effective January 1. Okay, so any changes we make are for a January 1 effective date. Okay, here's another way to look at it. The enrollment period is October 15th through December 7th, and coverage begins January 1. Okay, so what can we do here during the open enrollment period? Again, anyone who has or is signing up for Part A and B can join or drop a Part D prescription drug plan. Anyone with a Part D can switch to a new Part D. Anyone with Original Medicare can get a Medicare Advantage plan. They can switch back to a different. They can drop it. They can switch back to Original Medicare, or they can switch to a different Medicare Advantage plan. Okay. So guys, this was quickly an overview of what Medicare is all about. Please, if you guys have any questions, don't be afraid to reach out to us, either by giving us a phone call or sending us an email, or jumping on our website and asking us for a quote. We're always going to be unbiased. We're always gonna try to figure out what's best for you. Okay, it's your policy. It's not ours. We're only going to show you exactly how everything works and what your options are. And with every option, it's going to be the good, bad, and the totally ugly, so you know exactly what's to come. If it makes anybody feel better, I do this for a living. I wish I was on Medicare compared to what we have under for policies under 65 years old. It's craziness out there right now due to the Affordable Care Act and Obamacare. There's just a lot of things going on. So don't feel bad. I wish I was in your position. I wish I was eligible for Medicare. So if you guys have any questions, anything that you guys want to talk about, just need a shoulder to cry on, whatever, we're here for you. Don't forget to, if you're watching this on YouTube, don't forget to subscribe. We'll periodically have new videos coming out. If you have any comments, please post them below. If you're watching this on Facebook, like our page, review our page if you're our clients. If you want to contact us and want a free quote, again, you can give us a buzz, email us, or you can go directly on our website and click a quote and fill out some information, and we'll get that to you. Okay. Also, opt into our emails. Changes are coming, and they're coming fast. We try to keep everybody up to date, and the easiest way to keep you up to date is through emails. Okay? So guys, I hope you enjoyed the video. If there's any questions, please, again, do not hesitate to give us a buzz. Okay? We wish you guys all the best, and we'll talk to you soon. Bye-bye.